Good day, friends of Buzzy. And for our new podcast listeners, hello. This is our first live podcast, and this is the first time where we're going to be talking about what is in the pipeline for Pain Care Labs. Those of you who have been following us, we are a company that is all woman, woman-owned, and we make devices that use mechanical stimulation. Mechanical stimulation is what some people would have called vibration about 10 years ago. But now we know that there's a very specific way that you can use mechanical stimulation to block pain. It's kind of like noise canceling headphones in that if you have exactly the right frequency and you know the frequency of the pain that's coming out, you can stop pain, like rubbing a bumped elbow. So today I'm going to talk about the new products that we have on the horizon and the exciting new developments in the past 2 or 3 weeks. First of all, you'll know that our initial device, Buzzy, is a very high frequency little bee guy. Here's one with a mask for COVID. But it's a very high frequency device that has a motor that gives the right frequency to cancel pain at the bottom. Now, about 5 years ago, we made the VibraCool Devices, which were essentially a Buzzy vibration unit, which is curved to fit around the joint that has problems, but made to fit inside a pocket with a compression unit. Turns out that ice doesn't work as well for pain in clinical studies unless it's combined with a compression unit. What we did was we took the vibration part or mechanical stimulation part of Buzzy and we added to it the ice part in a compression pack. So that many of you know and love as VibraCool. So what we have done most recently, and just got them, so there's a bunch of research that's out now, and so here's the VibraCool with a 28-inch compression strap for knee pain. It turns out that there are different frequencies that are better for pain blocking and different frequencies that are better for increasing. The muscle frequency is about 100 hertz. The pain frequency is about 200. So what we have done is we have created something called the VibraCool Pro. We have a number of these that are better shaped to fit on knees and in braces. These are actually put together, and I'm showing the camera now, to go to France because there are a couple doctors in France using 100 hertz. So we've created these for them to experiment with, and available soon to patients in the US, we have the VibraCool Pro 200 for pain. What we're doing with it is we're taking that same frequency and putting it in 2 places. So instead of just having the compression cuff with the device in it, what we're doing is taking the compression cuff that has 1 unit, we're putting it's called stereotactic, but a second unit on the compression strap, and then making it so you can put 2 of them together. So after limb surgery, after knee surgery, for elbow tendinopathies, we've got these 2 that are coming out. And so the VibraCool Pro units should be available by mid-year. We have just sent the tooling information to our manufacturers, and so these will be coming out soon. And right now we're talking to doctors who are putting together protocols to research these for opioid reduction. There's an opioid reduction grant that just came out from AARP that we're going to be sending around, with the idea being that if you can be discharged from the hospital after a knee surgery, after an ACL reconstruction, after a tendinopathy or elbow repair, total knee replacement, hip replacement, that if you can be discharged with something that you can control the pain of that works, that this could be covered by insurance and that it can decrease the amount of opioids that you need to be sent home with. So to that end, another new thing that's in the pipeline is a VibraCool Professional Kit. So these kits, of which you can see a nice little prototype now, these kits have not only a 100 and 200 hertz unit for recovery and for pain, but also ways to clean them for patients between patients for COVID, and a really long strap like a TheraBand so that doctors can try them on patients without having to dispense 1 unit per patient. So this VibraCool Professional Kit, we have 10 of now, and these we are distributing to the physicians that are doing the research on the opioid reduction. And finally, for our new stuff, as many of you know, we started a few years ago, 2016, with an Indigogo campaign for a low back pain device. Not only did this one Swedish guy find that high frequency vibration decreased pain, but also when it was used in a back plate for about 20 minutes, it could cause decreased pain for between 6 and 24 hours. So we started by making a plate that looked like this. And we tested this one. We got an NIH grant, which we're doing right now. And so this was the first one with 3 different vibration units put on the back. So this is what science looks like, people. That's the device that we started with. And so there are a lot of interesting things about vibration that we're learning and looking at for how to best address the nerves in the low back. And where we are now is we've got a fancier version of it. And just if you want to see what the inside of science looks like. So here is a 3-motor device on the back of a metal plate that's about 6 inches by 8 inches. So these motors together with a hot or cold pack against the back are then put into a new, we're calling it Duotherm. We may change the name, but right now, so the Duotherm has 8 different frequency patterns so that we can test and see if there are different frequencies and combinations of frequencies that do better for that prolonged low back pain that was first described. And the fun information is that this week we sent one of our 10 prototypes to a patient who was so excited about Duotherm. She's been waiting for Duotherm since we did the Indiegogo campaign and said she didn't care if it was a delayed outcome or if there was another new one. She wanted one. Now she could get it. So we sent it, and her email was, OMG, I have tried everything, TENS and Soothie and ice, and this works better than anything. So that is very exciting. So these are the things that we are working on at Pain Care Labs. We are sending out our monthly letters to people on our email list. So if you sign up at paincarelabs.com, you'll get a monthly letter from me talking about what we're up to at Pain Care Labs and thoughts about what it's like to have a small business and to run one in these times. If there are any questions about anything related to Pain Care Labs, stimulation, new products, when you can expect new products, and what we have in the pipeline, drop me a note, leave us a message, and I will be back in a short period of time answering any questions on COVID, but wanted to give a Pain Care Labs update. Thank you so much, and it's going to be fine.